It has taken me 7 years to be able to talk about this surgery, and the reason I'm doing it is because I got so much support when I was about to have it from other women who had recently gone through it. And I don't know if everyone else out there has the support system and the people they could contact that I did, but I had two women who emailed me back and forth so many times. They were so helpful. They walked me through everything, what to expect. This DIEP flap reconstruction cancer surgery that I had, that was directly after I had a mastectomy 7 years ago exactly. So before we go any further, I just want to let you know what to expect in this video. This is going to be really listenable. I'm not going to be putting up any graphic images, any, post-surgery healing images, no jump scares or anything like that. So you can definitely watch this while you are around other people. If your kids are in the room or anything like that, I'm not going to get graphic at all. And if you're squeamish, it'll just be me describing things. There will not be any photos. Those definitely do exist on YouTube, but I just wanted to sort of sit here almost like we're having a coffee chat so we can talk sort of one-on-one about what to expect and what happened to me anyway during this surgery. I'm gonna be as honest as I possibly can. It is 7 years ago though, so I am kind of trying to rely on memory, and so my memory of course is not perfect, but a lot of it is just seared into my brain, so I think a lot of it will be pretty accurate as it had happened. So first of all, let's talk about the little bit of a backstory about how I got to the point where I needed a DIEP flap breast reconstruction surgery, which I had in Toronto, Canada at Sunnybrook Hospital. My surgical oncologist was Dr. Francis Wright. And then my oncology plastic surgeon was Dr. Joan Lipa, who are both so amazing. When I say I owe my life to these women, I do. I most certainly owe my quality of life to these women. And you'll never be so thankful to a doctor as one who is literally cutting cancer out of you. And then the other one is reconstructing you so you can go back to living how you used to live. You can still have a full, happy, thriving life. I'm proof of that. There is a tomorrow, even though maybe you're dealing with this right now and it feels very scary, devastating. You're like 10 out of 10 freak out level. You can survive this and you can thrive. Anyway, back to my story. I was diagnosed with breast cancer when I was almost 40 years of age. What had happened was my GP just sent me, she's like, I send my patients when they're gonna be 40, when they're 40. Some people don't send their patients till they're later, but I have seen breast cancer in women around that age. So that's when I start my patients getting mammograms. So when I heard this, I was like, do I even really wanna get this test? Because I don't have any risk factors. This is not really something that runs in my family. I have no reason to suspect I could have breast cancer. I certainly didn't have any symptoms, not a one. And I went to get a mammogram and one thing led to another. And as you can imagine, I got to the point where it was, decided that I was gonna have to have a mastectomy. And so at that point we discussed, reconstruction options. And so I remember this really clearly. One of the doctors, either Dr. Wright or Dr. Liba, really manipulating me around my stomach. She's like, can I just check how much extra, I guess, tissue you have on your tummy? Because that is, in my case, where they took the piece of flesh that they used to make a reconstructed breast. Again, there's no photos or anything like that. So don't worry, I'm not gonna scare you with anything gory or anything like that. But I just remember her sort of grabbing me around the tummy and just sort of pinching it together almost to see how much extra tissue there would be. And she's like, I think you're probably gonna be a pretty good candidate. Of course, your other plastic surgeon will be a better judge. This is just a sort of preliminary thing, if that's what you wanna do. And that was what I wanted to do. Now, interestingly, there was a period after I had had the surgery, because it took me a long time to recover, and we can discuss that, where I was kind of like, why did I do this? Maybe I shouldn't have bothered doing this at all. Maybe I should have just had the mastectomy and been flat on one side. Why did I put myself through this? I don't think I look a lot better necessarily. Sure, I look okay with my clothes on, but I've gone through hell in the recovery process. And again, I will discuss that a bit. But fast forward 7 years, I'm really glad I did it. I really am super glad I did it. It has made my quality of life, I think, on the whole, really, really good. So we'll discuss. So I live in, as I said, Canada, where it's the home of socialized medicine. Luckily, this procedure didn't cost me any money. I am part of the Ontario Health Insurance Plan. So even for a reconstructive surgery like this, that is, I guess, cosmetic theoretically, because it has to do with cancer, it was covered by the government. Of course, if I just wanted to get like breast enhancement surgery aside from cancer, you have to pay for that out of your own pocket. That's a purely cosmetic procedure that is not covered by our provincial insurance plan. So I got scheduled for the surgery and I had to wait maybe 5 weeks to get it done. That was an intensely difficult period for me. I was extremely scared of general anesthetic because I had never been under general anesthetic before. And I was extremely squeamish looking at the photos of what it was supposed to look like after the procedure was done and what the reconstructed breasts look like, and illustrations of where they take the skin from and just everything designed to like basically make me feel like I'm gonna pass out because I'm not great with blood. I'm not great thinking about incisions. None of those things are things that I can think about without kind of feeling panicky, okay? So it was hard. I'm not embarrassed to admit that I went to see the psychiatrist who specialized in cancer patients at Sunnybrook Hospital, and he helped me out a lot, reframing my thinking about it. And I think a lot of, if I recall correctly, a lot of what he said was like, when it comes to like being afraid of, if you're disgusted as I was by post-surgery images, the way to get over that was just to like look at a lot of them and get familiar so that you're not at the point of revulsion anymore. And I never did do that, by the way. So, bad on me. It probably would have helped if I did. And then the other piece of advice he gave me about being terrified of general anesthetic, he said to me, and we talked about sort of my type of personality. I'm a bit of an avoidant person. So I like to avoid, as you may have picked up from the last, little anecdote that I said, I like to avoid thinking about things. So he said, probably for you, the general anesthetic, you may be afraid of it until it happens to you and then you'll be okay after. And that is basically exactly what happened. Like I was really scared. When they had the mask on me to put me under, I was crying. I am not embarrassed to say that I was so terrified of going under general anesthetic for an 8-hour surgery that in my case actually ended up being 9 hours long. Helen in editing here. When I mentioned that I look, quote, normal in clothes, unquote, this is what I meant. I'm wearing my gym outfit here. What I didn't mention was that after I had that first round of general anesthetic, which I was so scared of, I was never ever scared of general anesthetic ever again. In fact, 1 year after, I had a revision surgery just to sort of even things up with the reconstructed breast and the unaffected breast. And I was totally fine that time. Like I went under general anesthetic again and it was like the same team all over again. And I was like basically high-fiving people in the operating room. So the psychiatrist was correct. I had to live through it. And then I was kind of cured of the fear because they had a bit of difficulty reattaching, I think, a blood connection. I don't want to say it was like to an artery or something like that, but there was some difficulty getting the blood hookup going once they had connected the new piece of tissue to me. At least that's how I understand it. So that was a very nerve-wracking time. Not for me, I was completely knocked out under general anesthetic, but obviously for my family who knew that I should have been finished and waited around an extra hour. So I'm sure that was a scary time. I know it was for my husband. He was not terribly concerned, but no one wants their loved one's surgery to go for an extra hour. For sure, if you've been in that position, it's really nerve-wracking. Okay, so now I'm going to tell you about a class that I took before the surgery. I'm really lucky that at Sunnybrook they had a sort of 1 hour, I'm going to call it like a seminar with other women. So it was like me and maybe 5 other extremely terrified women sitting together in a room, and we had this really wonderful breast cancer nurse there. I think her name was Sherry Lee. She just sat us through this really kind of comprehensive walkthrough, and a few of us were going through different procedures, and it was like this walkthrough of what breast reconstruction surgery is, talking about what to expect, more illustrations, I think there was like a PowerPoint presentation, a chance for questions at the end, and it was just really nice to sit in a room with other women kind of going through the same thing. You feel you're not alone in those kind of situations. I was young at the time, and is it depressing to be sitting around with literally all senior citizens when you're 39, as I was at the time? The answer is kind of, yeah. You really feel that life is unfair. You feel like this really sucks. You shouldn't be going through this. The kid was very young at the time, but I had to get over myself, and I did. And let me tell you, I also went to a Look Good, Feel Better class where they teach you how to put on makeup and they teach you about wigs and hair coverings and stuff like that. And that was great too. And you know what? As sad as I felt for myself in the breast reconstruction seminar at Sunnybrook, when I went to this Look Good, Feel Better class that they, is also free, LGFB, I think is what Look Good, Feel Better is, a charity, and they do great work. So if you're interested in that, I say definitely join that, if for nothing else than to be in a room with other women, because the point I was going to make was that about half the women there were younger than me, so I was like 40-ish, and there was like a number of them in their 30s there and a number who were older, and I was probably somewhere in the middle. Unfortunately, this is a disease that affects women of all different ages. But overall, my suggestion is, if you're like me and you don't really thrive in like online forums, I found those terrifying. I did not like them at all, but I really found the presence of other women physically around me to be much more comforting. Definitely take part in any sort of in-person things that might be offered where you are. Luckily, it's not COVID time so much anymore. So if there are like in-person things, definitely try and attend them. You maybe like me will find a real comfort in being around, your peers, basically. People are going through the exact same thing. It is mentally makes you a lot stronger when you know you're not the only one. Okay, this is kind of funny, but one thing I do remember from the lead up to the surgery was I was actually trying to eat like a bit more so that I could keep up my stomach fat so they'd have a nice piece of tissue to get. Sorry, there's something in my eye. Because I had so much like crippling anxiety, basically, that eating was kind of a struggle. So I was trying to like sort of power eat things. Like, I don't think that that was necessarily a good idea. I just felt like I didn't want to have any reason to show up and then be like, oh, you've lost a lot of weight, this is not gonna work anymore. But I think that's kind of a silly way of having looked at it. So, don't listen to what I did. I'm just saying that is what I remember doing at the time. I just remember eating a lot of cake and ice cream at the time. So unless your doctor tells you to do that, don't do that. But let me tell you, when the time for the surgery came, I have never been so nervous for anything in my life. Like I said, I was like crying as they were like, putting the gas on me. And I was just basically losing my mind up until the day that I had to go. I was not in a good frame of mind, but I just took things one day at a time. If you're going through something like this or any kind of thing that's extremely stressful, and when it comes to like cancer type related stuff, just take things as little amount of time as you can. Like concentrate on 1 hour to the next hour. Concentrate on like half an hour. Just try and get through like the half hour. Get through 10 minutes if that's what you need to do. Just think, I will not think about anything except for the next 10 minutes, the next 30 minutes, the next whatever it is to get you through. Only concentrate on that like segment of time. So anyway, I have the surgery. I wake up, of course, completely dazed because I've been, under for like 9 hours, an extra hour longer than I should have been. I'm trying to remember what had happened that night. Oh yeah, so at Sunnybrook at the time, anyway, hopefully cuts have not affected this. You got your own dedicated like cancer surgery recovery nurse. Like I had a private nurse for the night, right? So this is, if you're familiar with like hospitals that are in a busy city setting, you don't get your own private nurse for the night, right? But you need a lot of attention when you come out of this surgery, as I recall. You can't drink anything, you certainly can't eat anything. And if it sounds difficult to get through a night without any water after having been in surgery for 8 hours, it was. I remember being thirsty, but I remember the nurse like taking like a sponge on the end of something that looked like a giant sort of skewer, but it's plastic. Obviously she's not gonna poke you, but she would dip it in the water, like ice water, and like put it in my mouth basically. And so like that was my hydration for the night. I just remember being not in a terrible amount of pain because I was just hopped up on intravenous like painkiller, probably morphine, I can't remember at the time. They give you the good stuff because you've been through a major surgery at this point. And I think I was in hospital for a total of 5 days. Now, the next day I had a nurse who was not like this angelic, like overnight nurse. I wish, I was just too dozed and dazed out of it to remember her really at all, not even her name, nothing. She was an absolute angel. She was just constantly looking after me, moving me from side to side, helping me, everything I needed to do, she helped me do. I didn't want for anything changing I can't even remember. I just remember she was just extremely attentive, really nice, awesome woman. Okay, so the next day comes around and I'm getting a nurse who's like busier because she's like attending to a lot of different patients at the same time. And I'm starting to suffer at this point, like things are starting to get difficult. So my one piece of advice to you, if you possibly can, and I know not everybody's in this position, but if you have someone who's allowed to come to the hospital with you and maybe someone else who can come a bit overnight, don't hesitate to ask them to come help you out. Just life is much easier when you have that person who can grab you a drink, who can maybe help find the nurse if that's what needs to happen. Like just having an extra person around speeds up the healing process, especially if it's like a family member or a good friend. I had both of those situations and scenarios happen for me. My husband came and stayed. The second night I was there, he didn't. A nurse was just looking after me. That was a tough night for me. So then the third night he came and he stayed up all night to help me out, just like going to the washroom, just getting a drink of water. Like you can't do very much, right? You're really kind of bedridden while you're trying to recover. You've had in my case, a major cut along my stomach, right? So it's not that easy. We'll talk about that in a second to recover from that part of it. And then I think the last night that I was there, my friend came, bless her soul, and she stayed till, I don't know, the wee hours of the night to help me out as well, just so that my husband could go and get a bit of rest. And like I said, especially at night, it's really helpful to have an extra person there if at all possible. If people offer to come and help, please do accept them. This is the time of your life where you should be accepting help, not trying to be the martyr and doing everything yourself. Okay, another part of the recovery process after the surgery that I'm starting to remember now while I was still in hospital is that, I remember the doctor reminding me that I should be like paddling my feet and like doing a coughing, I think, or deep breathing exercise because of the effects or the post effects after anesthesia. I didn't do that. I don't know why. I just heard it and it kind of went in one ear and out the other, even though I had read it, I think, in my paperwork, and I probably even got told this during the seminar that I had told you about. I know better now. Do it. If you're told to do it, please just do it. Do the little exercises they tell you while you're in the hospital. They will help you, because I think what ended up happening is I was running a bit of a fever, I think, if I were recalling. I think I might have even stayed an extra day more than I was supposed to. And it partly had to do with my lung function or something like that. I can't exactly remember, but I think that had I done the breathing exercises I was told to do, probably, maybe that might not have happened. Who knows? So another thing that I do remember as well is that you're encouraged to get up and walk like the day after. And to me, that's shocking, because you have drains coming out of you. And if you don't know what those are, look it up or you'll find out. You have drains kind of popping out of you in different places. A friend of mine gave me the tip that you should get like a safety pin so you could pin those drains so they're not just like dangling. You get like a safety pin. You don't pin through the drain, obviously, you kind of pin around them, and you pin it up into your nightgown so that they're not sort of dangling. And she had also recommended getting a really loose nightgown. If you're getting like a big surgery on your abdomen, like you're not going to be pulling up pajamas over that. So you want a really big tent-like loose nightgown. But I remember having to get up. And I remember that being so difficult. I remember the nurse helping me, and I remember the sensation of needing to faint. I was like, I think I'm gonna faint. So she sat me right back down quickly. Like, luckily she was there, my husband was there too. So be wary when you get up for the first time. But I had to. I was told to get up and start getting that blood flowing, getting your lungs back working again. It's just good for tissue recovery, blood flow, everything, circulation, you name it, right? Because you don't want to be like lying bedridden for a long time. That's not good after a surgery, not after this surgery anyway. After the surgery, especially if you've had tissue excised from your abdomen, as I did, it's very tight, right? Because all of a sudden now you're missing this sort of piece that was there, and now it's sewn back together. So I was like a little bit hunched over, like walking around like that, and also just not so much because I felt it was tight, that was part of it, but I was just also thinking I had to protect the area. And so a physiotherapist at the hospital, she's like, oh, I saw you walking around quite hunched over. She's like, you can straighten out a little bit more. So I did do that, and I stopped walking around like a hunched old lady and stood up a bit straighter. But it was misery. Like, I don't want to say it was easy walking around after I've had that surgery. Like, I would have loved nothing more just to like lie there for 5 days and not have anybody bother me. I did not want to do any of these things, but I forced myself to do them. I didn't have a choice. The nurse like got me out of the bed and got me walking around, and then the physiotherapist was like visiting me and all this kind of stuff. So it was wild. It was just wild. I cannot even believe I lived through that, but I did. Okay, so in my breast area, that was very swollen. Obviously, you've had a surgery. This is like brand new tissue. They saved the skin. So I had the mastectomy with skin saving procedure. So the breast skin was saved, and I don't even want to know what they did to the rest of the tissue. Just thinking about that is kind of still makes me a bit squeamish to this day, but they did hang on to it, and my original skin is still there. But I had a lot of like sort of extra swelling, not to the point where I couldn't be released from the hospital for that reason, but it just took a long time for the swelling to go down. So I'm just saying, like, that happened to me. It took a very, very, very long time because, there's not a lot of, like, once the fluid is in there, there's not a lot of way for it to come back out. You have the drains, those do help a bit. If you have a bigger piece of tissue, as I did, put in, that just was how it was in my case. I just had quite a bit of swelling. It did go down eventually. And the walking I found really helped with that. The days that I didn't do whatever walking I was supposed to do, like if I cut back even a little, I did notice a difference. So definitely look after your health by walking. Look after yourself post-surgery by walking, if that's what's recommended for you to do. Obviously don't if that's not what you're being told to do. Okay, once I was at home, I had a home nurse visiting me every single day, and the reason was to clean out my drains. If you don't know what a drain is, like I said, have a look. They fill up, someone has to come and clean them. Eventually, in my case anyway, the home nurse was the person who pulled them out of me as well, and that hurt, I'm not gonna lie. I think one of them was pretty easy, but I had other ones as well, down below my like abdomen area, and those hurt a lot getting yanked out, but it only hurts for a minute. Like, imagine someone giving you like a pinch. That's what it feels like. So the reconstructed breast, aside from the sort of swelling that I was telling you about, never gave me really any trouble. You know, you're wearing like a mastectomy bra over it. It's like generally pretty well supported area. Again, if you have drains dangling when you're at home, use the safety pin trick that I told you, or find some other clip. There's probably something on the market now for that, just to clip up your drains so not dangling. If you're showering, what you can do is just like, you just get like a string, like a piece of string, and then you sort of clip your drains to that. Otherwise, they'll just be hanging all over the place. So when you shower, that's just a way to be able to shower and sort of have them not yanking, right? Because that's extremely uncomfortable and not good. Obviously, you don't want to yank on those. Okay, let me explain this a little bit better. What I meant to say is that you tie a bit of string into a long necklace, and then you can clip your drains onto the necklace while you're in the shower. It just makes things a lot easier so that the drains are not dangling in the shower. The real trouble though was not really the breast area, it was the abdomen. And the 2 other women, maybe 3 other women that I know that had this surgery, each one of us had some sort of problem with this big incision that we had. It goes from one hip bone all the way to the other hip bone. That's a lot of open area. So for me, I had like one little stitch that they hadn't taken out, but it was so hard to see, but it would not, like my scar would not close in that area. And my doctor finally took a really good look at it, and she's like, oh, there's a stitch. So she pulled that little stitch out, and even then it didn't really want to close up. I was given like really good, like the really good quality, like band-aids that they give you, bandages that they give you, you know, that have like porous breathability, whatever, that they give you in the hospital. I actually found band-aids in the end to work really good on that one spot, oddly enough, like just Band-Aid brand Band-Aids that you would use on your finger. I actually found that superior to the ones that they were giving me, like the specialty Band-Aids for wound care and stuff like that. I also forgot to mention that if you're using a piece of abdomen tissue, you get a brand new belly button. I knew this. A friend of mine didn't know she was going to be getting a new belly button, so when she looked down, she found out she had a completely new reformed belly button. In my case, that belly button had a lot of sort of red around it. Nothing was wrong, it wasn't infected or anything like that, just as a function of the tissue, just looked quite red there for a very, very long time. And now all the redness of the scar has faded and it just looks like a normal belly button. I don't think if you saw it, you would be able to tell that it wasn't my original belly button. Men, it was a long healing process. I think that they tell you you need 2 months or something like that, and you certainly do. Like maybe you don't, if you like me are kind of sedentary. If you have like a sedentary job, you know, I'm someone who just sits at the computer, it's not that taxing, but 2 months, like there's no way I would have been able to work before that. There's no way if I was like someone who's a server at a restaurant, I would have been able to do that job. I'm sure there are women that have to do that, and it's a lot to recover from this. It takes time. The other thing that I completely forgot to mention is that during recovery at home, I was lying down a lot and I had to have 2, 3, maybe even 4 pillows underneath my legs to kind of prop my legs up, which sort of helped not put so much tension. And I'm not even sure I could have laid out completely flat. That would have been really painful. And I had to sleep on my back. I'm a side sleeper, so I had to sleep on my back for, I'm gonna say months, definitely at least 4 weeks after. And I think that that was actually not just out of comfort, but I'm pretty sure my surgeon didn't want me tipping from side to side, also because of the abdomen situation that I had going on. You know, if I were an early childhood educator, like pick up small children, like after the surgery, forget it. Like do not think you need to recover faster than you recover. Like it takes whatever amount of time they say it takes is how long it takes. Like that is not some sort of generous overestimate. Don't be some sort of like hero where you're going to be like running a marathon in 2 months or something. You're not. Don't even think about it. So when I say it was really difficult, I do want to be a little bit more specific about that. You know, I had a lot of pain. My pain was fairly well managed, but at some point I was just not on prescription painkillers anymore, and I was dealing with just Advil and Tylenol, and I found that they were sufficient, but they would wear off, you know, right around the time that I needed to re-up. I had about an hour of pain that I wasn't particularly well managed, and that would wake me up sometimes in the middle of the night, and, you know, there wasn't a lot that was to be done about that. I certainly was not given any more prescription painkillers, and there are plenty of reasons, really good reasons for that, but that meant that I did have a bit of pain. It wasn't always super well managed. There's the mobility issue where you're kind of just like lying on your back a lot to recover. You can't really move from side to side. That was kind of unpleasant for me because my legs were sort of propped up as well. Once again, the area that gave me the most trouble throughout was consistently in my abdominal area with that really big long scar. The breast was just not really a factor. I didn't have a lot of pain in that area or sensation in that area. Everything pain related was related to my abdominal stitches. A lot of people suffer from constipation after going through such a long surgery, and also with prescription painkillers, or the painkillers that give you when you're recovering in the hospital. Luckily, it's never been the case for me. I was given a lot of advice from my friends about like how to deal with constipation, and from the doctor as well. Like I think even a prescription stool softener or whatever it was. I never actually needed it, luckily for me. So I just don't have a lot of advice or a lot of things to say about that. Just luckily that it never happened to me. Give yourself time to heal. Like there's plenty of time for these things. This is like recovering is like a marathon. It's not like a sprint. Give yourself grace, give yourself space. I had a friend organize like 2 months of meal drop-offs. Like, can you imagine? Like people were coming for like twice a week for like 2 months. She had done like a whole rotation. And I was grateful for every single one of those meals. Like whatever help people want to give you, please do take it. The recovery was incredibly hard, incredibly hard. I'm not gonna sugarcoat it for you. If I had to do it again at this age, I don't know if I would. Like that's the honest truth. I'm glad I did because, you know, I had it done. I never have to think about, well, should I have had it done or should I not have? Would I have been happy with it? Like I wasn't in the headspace to make that decision. I will say though, for a while after, I was a bit unhappy. Not with how I looked. Like I always look really good, like with my clothes on and stuff like that. You know, my doctors did an amazing job of restoring me to how I used to look before any of this happened to me. But my goodness, you have this huge scar. You have this like fake breast. The breast doesn't have, I'm gonna put the word up here so I don't get demonetized, but it doesn't have on it. You look like some sort of Frankenstein Barbie doll for the longest time, and it's very hard. Like you get or at least I got a bit of a dysmorphia about it where I was like, why did I do this? I look terrible. I look crazy. I look like something Dr. Frankenstein put together, right? But you do get over it. Scars really lighten. It becomes, you know, you get used to seeing yourself. But I don't know that anybody can prepare you mentally for just like waking up and looking not just different, because people do that all the time. They have surgeries that make them look different. But to have these body pieces that are kind of rearranged is just not an experience I've ever had before, and not really one I care to repeat in the future. Let's put it that way. But what I was really grateful for, of course, was just obviously having the cancer removed and then having this other surgery. I was lucky that I was able to do them both at the same time, just the way that things worked out with my treatment plan, and just have it kind of behind me, right? So it was like climbing a big mountain, and then, you know, you're over the top of the mountain, and then like that's the peak. And then you start to go down the mountain again. But, you know, climbing up that mountain was incredibly mentally difficult. So 7 years later, I'm glad that I did it. I'm certainly glad that I am lucky enough to have been in the care of such amazing doctors. Would I have been crushed if I had made a slightly different choice and maybe just decided to have just the mastectomy? I think I could have been okay with that. You know, my personal self-identity has never been like that of a swimsuit model or anything like that. And that's not the point. They're not trying to make you look like a swimsuit model or anything like that. But, you know, my identity is not necessarily someone who's really wrapped up in my own physicality. You know, I'm kind of a nerdy person. I don't live in a hot climate. I'm covered half the year. But it is still nice. It is really nice. I'm not gonna lie. It's nice to be able to go to the beach and like wear a bikini, or like wear the things that you used to wear a swimsuit and not feel weird. Overall, I am happy with the result. So if you touch this side, that's the unaffected side, maybe you haven't had anything done here, you'll feel cold. Your chest will feel cold. Now, when you switch to this side, what happens is the sensation goes into your fingers instead, and your fingers feel warm. They feel like they're touching something warm. So you'll feel cold on your chest here. And just by switching hands like this, that side will feel warm. It's really strange. It's a really, really strange sensation. But this is interesting. As the years have passed, I've actually grown back nerve sensitivity. And I had a tattoo done in the area. I'm not gonna say the word, but you can get a tattoo done so that, you know, your twins match a bit better. When I had that done, I felt it. It was really it was painful. It felt like I was getting a tattoo. So I know that some nerves have grown back. And even just since then, like if I get poked or like knock myself on something, I do feel it. So I know that I've read that some women never regain any sensation there. That has not been my case. It's just not exactly like the other side. Tissue wise, yeah, they feel different. Like the side of the reconstruction feels much more dense, not in a bad way. It just like feels like a different part of the body almost than the other side, which feels much squishier. And it's not painful or anything like that. You know, there is definitely a sensation of it feeling slightly different. It's not uncomfortable, it's not painful, but it is a sensation of there being something there that it's just, I really don't know how to describe it because it's not like any other sensation I've encountered, but I can tell you it's just not painful or really bothersome. It's just like an awareness sort of in the back of your head that the side feels slightly different. And it's not something that you find like draining or like something you're expending a lot of extra energy. By and large, I don't think about it at all anymore. You know, I've just moved on with my life. So if you're watching this surgery and you're gonna get it, don't worry, you got this. It is hard, you know, I'm not gonna lie. I would be like, you're not gonna tell someone who's running a marathon that's gonna be a piece of cake, because that would be a lie. So I'm not gonna lie to you. Nobody's ever told me that they sailed through this. No, you know, the recovery is difficult. The dysmorphia that I had anyway is difficult. There are a lot of difficult parts of this. You may at some point, as I did, think, oh, why did I do this? This is so hard, you know, but you will get to a point, hopefully this is just a blip for you in the distant future, where you'll be like, I'm glad I did this. I'm glad I got it over with. I'm glad I can walk around and look like the way I used to. And alternatively, if you don't get the surgery and you decide just to get the mastectomy and forego a reconstruction, that's cool too. Like, who cares? It's your body. You do you. You know, we're all just trying to make the best decision with the information we have at the time we have to make that decision. So go with your instinct. Talk to other women who've maybe gone through it. If they offered any sort of seminars, webinars, whatever, go for that as well. One piece of advice nobody asked me for, but I'm going to give you anyway, is like, I started to let people know. Some people like to be very private about this stuff, but I had a lot of different business contacts and stuff like that. A lot of women connected me to other women that they knew had just gone through it. They ended up being a lifeline for me. So, you know, if you're very private, obviously that's not going to work for you. I'm not the most private of people. Like, if I'm going through a health crisis, I will tell people. I don't think there's anything to be private or ashamed of. I'd rather them just know. I don't believe in secrecy around these issues. And that ended up being one of the wisest things I feel like I did, because I got so much help from so many great women. And that's actually why I'm making this video too. I wanted to make sure that I put this sort of breadth of knowledge and experience that I had having this, like, honestly quite difficult surgery. I wanted to make sure that I made a video or did something with this information. It took me a long time to be able to get to the point where I could do this. I didn't want to talk about it for years. I just found it like stressful, you know, trauma, like post-traumatic stress disorder, like whatever you want to call it. I did not feel able to talk about it until now. So I'm glad that we have done this. All right, you got this. You can do this. It's going to be okay. Hope that was helpful. If you do want to support me, one way you can do it at no cost to you is just hitting that like button down below and subscribing. That really helps me out, helps these videos do a little bit better. I also have a newsletter. I don't necessarily talk about this subject, but I talk about like beauty products, and I have humor essays and fun stuff like that. HelenAvery.substack.com. And please do watch another one of my videos. That would mean a lot to me. It doesn't have to be on this subject. I have other topics that might be of interest to you as well. Thanks so much. We'll catch you on the next video.